Hello and welcome to today's webinar. My name is Dr. Yuri Ilkovich. I am a hospital medicine physician. I was fortunate to take care of thousands and thousands of patients in inpatient hospital care. And I'm going to start with this simple slide. What do you think is more powerful in medical care? Advanced technology, which is represented by the picture on the left, or simplicity and accuracy of medication list. And I'm going to move to the statement and to the question for today's webinar: how to own your care, keep it sharp, because accuracy saves lives. So I have a question for you today. Why do we take cholesterol medicine? Why do we do colonoscopy? Why do we wear a mask? Why do we do vaccinations? Or anybody in the room here is taking a blood thinner or aspirin. There is one common reason we do all those things, besides we've been told to do this by our doctor, is to do prevention, is to do something that might prevent a bad event, a bad health decline in our life. And that makes sense when we look on the 10 most common causes of death in the United States. And along with the heart disease and the cancer, and this is what we do in these modalities to prevent cancer, or not even prevent it, just to catch it on the early stage. There is one thing called unintentional injuries. And one of the unintentional injuries is actually a medical error. Look at this statement by Johns Hopkins studies that claiming that medical error is a third leading cause of death in the United States. More than 250,000 patients die from the medical error. So what can be done to prevent medical errors? Let's just start with a simple look at how actually any error is happens. Because error is actually unintentional deviation from the truth or accuracy. In this simple slide example, one change of the letter from D to T will change a total meaning of the sentence and the statement. So instead of "we want your feedback," will become "we want your feet back." So number one cause of medical error is a communication error. Look at this medication list of one of my patients. I'm sharing with the permission, but just look at that. Don't you think that this list, this medication list presented to the medical team, is the high risk of creating a situation for the medication in a medical error? And even with advances of electronic medical records, we can believe that it is all in chart. It's all in my computer. But look at this. This is a real slide, a real snapshot how it actually look on the electronic medical records. You may see it looks pretty cool. It has all the medications, but it does not show how many times per day you take it. You might have all the medications, even those that you no longer taken. So when this medication list is getting carried over and you, God forbid, get into the hospital, there are some potential of the mistakes and errors that might happen in the hospital care. The most common scenarios, patients are given medications in the hospital for the patients that they are no longer taken at home, and the blood pressure goes low, and all sort of things can happen. Patients may be given wrong doses of seizure medicines, and the seizures are happen in the hospital settings. Patients may receive a wrong dose of insulin, causing to significantly high or low insulin blood sugar levels in the hospital. And it goes beyond the medications. It can go to simple information. For example, what is the serial number of the pacemaker? That simple piece of information on time can allow us physicians to order MRI and diagnose a stroke today at this moment, not tomorrow, because we are not sure if we can order MRI if your pacemaker will be compatible with the MRI machine. So 2 things that I may suggest today to improve your care and to prevent medication and medical errors will be to take charge, to take ownership of your medical history and now your medications. And this is where we would like to help you. We are founding this simple to use MedSync electronic healthcare organizers, which can allow you to put control of your health and control of your health information in your care, get it in your hands. Keep all your important data like the hospital visits, medications, medical conditions, and surgeries in one place. And have it handy, have it portable, have it available anytime you can share that. We are founding our platform with the 3 basic principles. 1, patients should be in charge. 2, accurate patient centered records should be a paramount of medical care. And 3, everyone should be on the same page. So how it works? I'm going to recommend 3 steps: create, share, and update. Create medical records. Create profile on the MedSync. It's one-time thing, takes a couple minutes, and you have it forever. You can update any information, including your medical problems, surgical problems, allergies, medical devices information, your blood type, even your spiritual or religious needs, or any information that you think will be nice to have available in your chart and to share with your providers or for your loved ones. Number 2, share with medical team. God forbid you need to go to the hospital or to any new provider, you can share all of that in one click. The most important, the most accurate information in your care. And 3, update that profile on the go. So it's 3 things: create, update, and share. Create, update, and share. Thank you for your attention. So the next thing will be to click on app.medsync.me and create a patient account. See you there.